Cancers are grouped according to the tissues where they originate. This is referred to as the primary site. For example, a tumor in the lungs or brain may actually have started out as a stomach cancer solid tumor that metastasized, and the cells traveled through the lymph or the blood to the brain and formed a new tumor. But when it is looked at under a microscope, it has the features of a stomach cancer cell. Carcinomas arise in epithelial tissue, the cells that cover the inside and outside surfaces of our bodies. Sarcomas arise in connective tissue, the tissue that forms in the bone and soft tissues of our body, including muscle, fat, blood vessels, lymph vessels, tendons, and ligaments. We also have leukemias and lymphomas. Leukemias are cancers that originate in blood-forming tissues. They do not form solid tumors like the carcinomas or the sarcomas. Lymphomas originate in T cells or B cells. Some treatments work better on certain groupings than others. That's why it's important to know what type of cancer you have, what the origin of the cancer is, the primary site, and we'll talk in a few minutes about the stage and the grade of the cancer. Symptoms vary depending on the type of cancer. Many cancers are asymptomatic in the early stages. I've been asked why, for example, pancreatic cancer is so difficult to treat. It's because pancreatic cancer doesn't provide symptoms until it is very late, until it has progressed. The same with cancers of the liver and of the ovaries. Signs often appear long before symptoms, so there may be things that you can see or feel that don't cause discomfort. For example, a woman may find a lump in her breast, changes in moles, or blood in the stool. So these are signs that can appear before you may have any symptoms. But what you need to know is that lumps, abnormal moles, and blood are not always going to lead to cancer. They are a sign that you need to have it checked out. Blood in the stools may be due to hemorrhoids and not colon cancer. But when you find these signs, you want to have them checked out by the doctor. Lung cancer is the leading cause of death in the United States. Second most commonly diagnosed cancer in both men and women. For women, breast cancer is the number 2 cause of death. Mortality means death. For men, prostate cancer is the second highest cause of cancer deaths. And then there are colorectal cancers, which are the third leading cause of death and the third most commonly diagnosed cancer. There are different types of lung cancers. You don't need to know the different types, but I want to share them with you. There's what's called small cell or non-small cell carcinomas. Small cells diffuse and spread more easily. The non-small cell is more easily treated. Again, this is not something you need to remember. This is informational. Average survival, if left untreated, is 8 months. Lung cancer is a very difficult cancer to treat. The earlier it is caught, the greater the chances for survival. 10 to 12% of smokers will develop lung cancer, but 87% of lung cancer victims are smokers. Other factors that can lead to lung cancer are asbestos, arsenic, and radon. Women may choose to do self-exams in order to become familiar with their breast tissue. Data suggests that it's not very effective in diagnosing breast cancer, but many women feel it's better than doing nothing. If you want to do monthly self-exams, make sure you do it at the same time every month because breast tissue changes throughout the month. The textures change because of the menstrual cycle. The suggestion would be perhaps 5 days after you're done menstruating to do a breast exam. Mammograms, I explained to you what mammograms were at the beginning of this topic. They're not very sensitive. They may miss some tumors. They may have false negatives, but it is still being recommended to screen women with mammograms, and I'll talk about that in the next slide. Some women are easier to screen than others, and that has to do with the density of the breast tissue. Breast tissue that's higher in fiber is harder to x-ray than breast tissue that is higher in that contains more fatty tissue. MRIs may be too sensitive and detect many non-cancerous lumps. These would be the false positives. In 2015, the American Cancer Society released a statement saying that some cancers detected by mammograms would never have posed a threat to a woman's health or a woman's life. and that others are so slow growing that even if they weren't detected until they caused symptoms, they may still be treatable. Yet other tumors are so aggressive that even catching them early is too late. In these situations, mammograms would therefore have had little effect on whether or not a woman's mortality was affected. This statement was very confusing for women. It's still confusing for women. Screening used to recommend having women start getting mammograms at the age of 40. Now it's recommended to talk with your doctor based on your family history, based on your personal feelings towards having these kinds of exams, on whether or not you should have a mammogram and how often you should have them. Risk factors for breast cancer include mutations or defective BRCA1 and 2 genes, age. Actually, the number one risk factor for breast cancer is being female. I know that doesn't help, but that happens to be the truth. The defective genes and age are pretty clear risk factors for breast cancers. Other risk factors that are not so clear: women with no children or having children later in life, and hormone replacement therapy use. And this is because both involve the hormone estrogen, and estrogen may be related to the development of breast cancer cells. You may see products that tell you to buy them because they will prevent cancer. You may see advertisements for workshops offering steps to prevent cancer. Please know there's no way to prevent breast cancer. Even prophylactic mastectomy can't prevent breast cancer because breast tissue can be located in places that weren't removed during the surgery. But what we can talk about is risk reduction, or ways to reduce the risk of developing breast cancer. Diet and exercise, decisions made about pregnancy and nursing, tamoxifen for individuals in families with a strong family history of breast cancer may want to take this drug. It does increase the risk of uterine cancer, but for some women, especially if they've had hysterectomies, taking tamoxifen can help reduce the risk of developing breast cancer. And the mastectomy is the most drastic action that can be taken by a woman, especially if it's prophylactic, done to prevent breast cancer. These are decisions that women who find out that they have the BRCA mutation often make. Other female-specific cancers include uterine cancer, cervical cancer. This is, again, where I tell you, please get the vaccine, and ovarian cancer. Now, the grade and the stages of cancer are important in determining treatment. The grade of cancer is based on the shape of the cells. You don't need to know the specific details, but I'm going to give them to you. Tumors are graded 1 through 4 based on their level of resemblance to healthy, differentiated, or mature cells. The low grade are less dangerous. They look differentiated, meaning that you can tell the difference between the cells. The higher the grade, the more dangerous the tumor, because the cells are what are called undifferentiated. They may have multiple nuclei. They may not have well-defined cell membranes. These are signs of a more dangerous high-grade tumor. Cancers are also based on tumor size, penetration, and spread. So TNM stands for tumors, nodes, meaning how deep it's penetrated, and metastases, whether or not the cancer has spread.